Welcome back to this channel, ladies and gentlemen, to the returning subscribers, to the new viewers. Kindly make sure that you keep it locked in this channel. Kindly like, share, comment to these videos. So today I want us to begin a session talking about the various conditions that affect the female genital tract, and of importance, let us begin with what we call vaginal candidiasis, vaginitis. So vaginitis is any condition that could result in vaginal discharge, itchiness, or burning sensation. So vaginitis can be widely classified into two causes, that is the non-infectious causes that account for 90% of cases of vaginitis, and 10% that accounts for what we call non-infectious causes of vaginitis. So today let us talk about the 90% that represent the infectious causes of vaginitis. So under this, we have three main classes of infection. The first one is what we call bacterial vaginosis, or BV. The second one is vulvovaginal candidiasis, and the third one is what we call trichomoniasis. So of importance today, we are going to talk about bacterial vaginosis. So let us picture the female genital tract of the vagina. So the vagina, macroscopical, when you look at it with the naked eye, you may think that it is just somehow not small, or it is an organ within the female body that you could see maybe it is smaller in size, accounting for only 1% of the female body surface area. However, microscopical, the vagina is huge and it contains quite a lot of bacteria that move around freely within the vagina. So these bacteria are what we call the vaginal normal flora. Their main work is to keep the vagina clean, keep its normal scent, and also keep the environment within the vagina within tamed values, and also to ensure that the vagina is protected against any form of infections from within or from without or from external causes. So any imbalance of these bacteria within the vagina, which we call the normal flora, could potentially lead to an infection within the vagina, and most commonly what we call bacterial vaginosis. So bacterial vaginosis is the most common form of vaginitis, and it is caused by a bacteria that is called Gardnerella vaginalis. So this Gardnerella vaginalis is also a bacteria that is found within the vagina that acts as a normal flora. So what could cause an imbalance within to this Gardnerella vaginalis and therefore predispose a woman to what we call bacterial vaginosis? So this brings us to risk factors. So risk factors number one is pregnancy. Pregnancy, as we all know, during pregnancy everything changes in the female body, from their hormones, from how they function, from their metabolic activities, and everything within the female body. So due to this, the vagina is not left behind. A lot of things change in the vagina, even the pH, and therefore when the pH changes, it rises to a pH of more than 4.5, and this one could predispose the woman to what we call this bacterial vaginosis. So pregnancy is one of the risk factors that predisposes somebody. The second one is what we call vaginal douching. Douching is a situation in which a woman decides to pour in squirts of water inside the vagina, mainly for the purposes of cleaning it. So this one is wrong, mainly because it washes away some of the vaginal normal flora, and it even introduces new bacteria into the vagina that should not be there in the first place. So washing away of this vaginal normal flora and introduction of these new bacteria causes an imbalance in the vaginal normal flora, and therefore could lead to overgrowth of this Gardnerella vaginalis and predisposes this woman further to what we call bacterial vaginosis. The third one is introduction of foreign bodies into the vagina. This could include technology that some of our ladies nowadays use in order to pleasure themselves sexually, or intrauterine contraceptive devices, or rather coil that is inserted through the vagina into the uterus for the purposes of family planning. So a combination of these three factors are what could predispose someone to the risk of developing bacterial vaginosis. So a combination of these three things could predispose someone to developing this bacterial vaginosis. So how do you know that you have bacterial vaginitis? It is interesting because there are distinct signs and symptoms that shows that someone has this bacterial vaginosis. The first thing that is characteristic is a grayish discharge that is foul smelling, characteristically smelling like fish or fishy smell that is worsened especially after sexual intercourse. So if you have a discharge that is grayish in color, it could be whitish. In some cases, I've seen other articles saying that it could be yellowish, but majorly grayish in color and having an odor, characteristically fishy in smell, and it worsens, the smell worsens after sexual intercourse, then typically this one is what we call bacterial vaginosis. And this discharge, it can also be seen when you are in a position to look at yourself in a mirror. You can see that it is able to adhere to the vaginal walls. Okay, so that is the first thing. Another thing could be burning sensation or itching sensation, or what we call pruritus within the genitalia. So when you have this, clearly indicates that you may be having bacterial vaginosis. So yes, now you have them, we know what the risk factors were. So what should we do? One, please, as a lady, do not dodge. The vagina in itself, as I had said earlier, has got what we call the normal flora. Though these bacteria do enough work in order to cleanse the vagina from inside. So when you try to clean the vagina yourself by pouring in water there, you are doing more harm than good. So these other things that you should also avoid are these detergents that are scented or feminine perfumes, or rather scented detergents that people normally use in order to clean themselves down there. Please avoid these things. And when washing the vagina, if possible, have its own bathing towel to wash it and use only clean water. Without soap, if you have to use soap, make sure that it is not scented and only wash where the eye could see. Do not open or separate the labias that you are trying to sugua, or rather to clean inside and pouring water inside there. No, that one is not right. That is what is called dodging. When you are pregnant, ensure that you are doing everything within your power to maintain genital hygiene. Take a lot of water and ensure that if possible, during pregnancy or even when you are not pregnant, you take what we call probiotics. And some of them, I normally see there's a yogurt that is called probiotic yogurt. These ones will help to nourish the normal flora within the vagina and thus protecting you from this infection. So you have this condition, you have this discharge, you have the itchiness and everything. What can we do in order to cure it? There's good news. Something can be done so that it could be cured. We use a wide variety of medication, and the one that we normally recommend the most is what we call metronidazole, or in layman's language, what we call Flagyl. However, personally in my practice, I don't normally like using Flagyl alone, but I like combining it with another antibiotic, most preferably clindamycin. So if we can get a pessary is a drug that is used to treat somebody that is inserted inside the vagina. So if you can access a pessary that has got combination of both clindamycin and metronidazole, perfect. So if you have this, you just insert it and the bacteria will be cleared and the infection shall be healed. Most importantly, maintain hygiene, no dodging. So until next time, I want us to quit at that today and make sure that everybody understands whatever is going on. Thank you very much. Thank you for coming back. Thank you for subscribing. Kindly share, like. And today, let me apologize. You may be hearing some noises in the background. Somebody, ancestors today, decided that we will not record in peace. However, we try our level best to make sure that we give you content back to back, day and day. Thank you. Until next time.